Hello, everyone. This is Michael Jenks. I am a certified prosthetist orthotist with Medical Center Orthotics and Prosthetics, and my title is the Senior Clinical Specialist for the Southeast. So that we've got the formalities out of the way. Really look forward to spending some time with you folks today. I wish it was in person, but we will make the most of it given the format that we have. I do encourage anyone there to please ask any questions that you might have. We'll try to cover those. Most likely we'll just do that at the end of the presentation. But if there's something that we need to stop the presentation for, the moderator can do that for us. So please feel free. A little bit of background on myself. Like I said, I am a prosthetist orthotist and have been practicing orthotics and prosthetics for about 30 years. In addition, my learning curve was greatly increased because my wife is an above-knee amputee, and just as a prosthetist, when I think know all the answers, I got to come home and learn that you know what, there's still things we need to do to improve everyday life as an amputee. So it's been a unique opportunity for me to learn about osseointegration as a clinician, but then also going through that experience with my wife, and want to share some of those thoughts and perspectives with you along the way for this presentation. The goals of this presentation, we want to really determine who is appropriate for osseointegration. There's lots of information out there, lots of questions. So I want to kind of tell you some of the questions and thoughts that we had on the front end, but then also some of the realization we had on the back end. One of the important things we need to look at is what's the right center for you. And by center, I mean not every surgeon in the country can do osseointegration. There are a select few, and I think each center has some different characteristics that we need to consider and think about. What's the recovery from the surgery look like, and what is the step-by-step of the surgery? We're going to cover some of that and talk about that process, as well as the rehabilitation that's involved. This is not a simple procedure, and it does involve quite a bit of commitment on the patient's part, and understanding what exactly is needed and that we've learned is needed at the time is going to be really important. We'll briefly discuss some of the components and some of the latest advances that are taking place. And like I said, you know, hopefully we'll get with some questions and discussions that we can head up as well. So where do we begin? One, I think we have to ask ourselves, why are we going to do osteo? It's additional surgery. That surgery got us here in the first place because of the amputation. So not many people are excited to undergo additional procedures. So why are we even considering this? Who exactly is osseointegration for? And like we said, where is the best place to have it done, and what type of procedure? Because there are some differences in the way that osseointegration is performed. And I think we need to have some general understanding of that. So why osseointegration? This is my youngest son decides he likes to experiment with different types of amputations. And, you know, it is important to understand what type of patients and what type of surgery is osseointegration for. Right now, the most common procedure for osseointegration is for a transfemoral or above knee amputee. They have done osseointegration for below knee amputations, as well as for upper extremity amputations. Primarily right now, it's for someone that's above elbow amputee. Really what we need to look at is, can that limb be fit with a traditional socket? Or does the patient have complications that proves it too difficult to be fit with traditional prosthetic care? And I really think that's something we need to emphasize, because at this stage of the game, and I think for the foreseeable future, osseointegration isn't the first go-to step without at least considering what traditional prosthetic care has. Amputees have proven to be extremely successful with traditional prosthetic care over the years. And I think osseointegration is really targeted for the population that cannot be fit with a traditional socket. And because it's a additional procedure, there are risks that are involved. And also it's not something that can be quote unquote undone very easily. So before we commit to osseointegration, we need to really understand, why are we going down this pathway? and what are the potential benefits that are going to be. Some of the residual limbs that we've seen that have been problematic, if someone has a very short residual limb, if there's a lot of redundant tissue, if there's a lot of scarring, those are different instances where traditional stock prosthetic fit might not be as successful as we want it to be. So again, why OI? Because we hate this stupid socket. Again, I hear that from my wife as an amputee, and I hear that from other patients. We as prosthetists pride ourselves on being able to take care of folks, but the reality is wearing a prosthetic socket sometimes can be a pain in the neck. For above knee socket, it can be a pain in the butt. So we really need to understand, is this just something that we're trying to get away from, a frustration that's going to be there regardless? Or is this a true problem that we're trying to solve? A lot of the frustrations with prosthetic sockets, working closely with your prosthetist, can be taken care of. Also understanding and take advantage of advancements in technology are going to help to make traditional prosthetic wear, far more comfortable and something that you can lead a relatively normal life. So it's really important that we understand, are we just trying to get away from something because of potentially a temporary frustration, or is this a long-term problem that just doesn't have a fix to it? Really need to discuss the challenges with your prosthetist, as we said. If your prosthetist can't come with an idea, the right idea or right solution, I strongly encourage you to get a second, if not a third opinion to you out there to make sure that you find the right combination that can work for you. Talk to other amputees about your struggle. I find over the years that I've been doing this, a lot of times what we say as prosthetists or as healthcare providers doesn't exactly carry the same amount of weight as someone that's literally in your shoes, living with a prosthesis on a day-to-day basis. My wife, when she wanted to learn how to run, all the instructions I could give her really didn't sink in or make too much sense until she sat down with another amputee and basically told her the exact same things I was, but it was a whole heck of a lot more believable coming from him than it was from me, because again, he was another amputee that realized that. I would caution that we're going to come back and talk a little bit. What works for one amputee doesn't necessarily mean work for another. We're all individuals. And again, I think it's a resource to talk through and troubleshoot with. Really work diligent with your physical therapist or your physiatrist. There are a lot of very well-experienced, well-trained physical therapists, but not all physical therapists are going to understand what some of the unique challenges that the amputee population brings to the table. So you got to make sure that you're working with a good qualified person. In addition, meet with your surgeon. A lot of times a surgeon in your area may specialize in amputee care. And while a surgeon, let's say if you're in a traumatic accident, their primary goal is going to be to get you safe and stable and keep you living, which is a really important and good thing. They may not understand some of the intricacies of working with the amputee population. So again, if you're having struggles, you really want to make sure that you find a surgeon in your area that has a great deal of experience and knowledge on working with amputees and understand some of the challenges you might present. Again, I go back, this isn't the easy button. Osseointegration is really amazing, incredible technology. And I have thoroughly enjoyed learning about what it can give the patients, that I've been shocked about what it can give the patients. But again, it's not the easy route to get rid of all those particular headaches and problems that you're having with the socket, because osseointegration is going to come along with some of the challenges as well as some of the considerations we need to understand. At the end of the day, being an amputee, unfortunately, is just a difficult challenge to overcome. It's a challenge that certainly can be overcome, and I'm sure many of you listening to this presentation have many stories of very successful, fulfilling lives, but we still got to put up with, dealing with a prosthesis. At the end of the day, that's something that is a challenge that just has to be understood and worked through. And again, I say that with osseointegration for a newer amputee isn't necessarily going to remove all its challenges. It's still going to take some work and dedication on the patient's part. So another consideration is why OI? What are the activities that I really want to get back to doing? because there are going to be some limitations of things that you can't do once you have osseointegration. And again, I think be very cautious when we go into social media and talk to other folks. Oh yeah, it's no big deal. I can get in a swimming pool all day long, or I've ran with it and I haven't hurt myself at all. This is new technology. I really don't know what the long-term effects are going to be right now. So right now we need to follow the science. We need to follow the protocols and what the experts that have the most experience with osseointegration tell us. And this isn't something that you want to be the forerunner of experimenting, because the problems that can arise can be quite severe and permanent in their effects. When we look at the picture, swimming in a public pool is not going to be recommended once you have osseointegration. Running is not going to be recommended either. The forces that it puts on to really some of the components, not necessarily alone, are too great right now. And again, and I say some of this with an asterisk, because we don't know what we're going to be able to develop and how we're going to be able to mitigate some of these contraindications. But right now, just know going into it, there are contraindications. If you want to get around lake water, swim around in a lake, again, that's a pretty specific contraindication to not do with your osseointegration. So before you go down the venture, know that there are going to be some areas that are going to be limitations to some of the things you're able to do. We see two different water activities. Right now, the suggestion is that salt water, in other words, swimming in an ocean, poses far less of a risk than swimming in a public pool or a lake. So it doesn't mean you can't ever swim with your osseointegration. Just know that those are some concerns that have been found and still exist. So where do we begin our osseointegration journey? Really, it's important to research the different types of osseointegration procedures. There's the OPRA system, which is a two-stage procedure. There's PressFit, that is primarily done out of Australia, but is being done here in the United States on a limited basis as well. So you have to understand some of the pros and the cons. And again, I think that's really a conversation that's better placed with a surgeon. I wouldn't suggest that you go out and talk to several patients that have had one versus another. Learn what the process is, what they went through. But certainly it's a surgeon that needs to sit down with you and talk about whether that particular procedure is going to be right for you. Understand the source of the information you're getting, and again, do your research and do your homework, but also don't take anything that you hear out there as a 100% gospel truth until you do your homework. Research and meet the osseointegration team. This is an area that I do have a pretty strong opinion on. There are some facilities that are coming online and coming on quickly, and a skilled surgeon is certainly kind of at the top of the heap of that. But in my opinion, I think you need to have a very well-established team that supports that surgeon, and more importantly, is going to be supporting you. That team needs, because that team is going to be touching your life pretty much every step of the way as you go through both the surgery, the recovery, and integrate back into normal life. There's lots of folks within that team that you're going to need to have interface with and rely upon, and they need to be a well-connected team so they can communicate to each other if there's any struggles or difficulties, or even just update your progress so that you can move through the process of recovery as quickly as possible and as effectively as possible. So again, I think when we talk about a team, I would, really sit down and talk to the surgeon, but, hopefully they're going to be able to meet the entire staff. Understand the expectation that team has of how many visits it's going to require to the physical therapist, to the surgeon. It's really important that you understand what that is. So if you're traveling to a center that maybe is a few states away, can you commit to making that travel? And that the protocol, the touches, that's all just going to benefit you in the end. And if you shortcut any of those, you're really going to be shortcutting yourself and potentially putting yourself at risk. You're not going to be taking advantage of what that team brings from a knowledge and what you can teach them as well when you discuss some of the challenges you might have. Certainly sit down and meet with other patients. I think that's critical. Again, when you're talking with these folks, a lot of times they're going to be extremely enthusiastic because that may be a procedure. Hopefully this is a procedure that was extremely successful for them. But just understand when you're talking with other patients, everyone's an individual. Because you're missing, one limb doesn't mean that, your body type is going to be the same. It doesn't mean your experiences, your healing rate. There's all different factors that you need to really understand. What is working for that patient might not necessarily be the best for you, but they can certainly talk to you about what they've learned along the way, what their cautions are, what some of the challenges, what some of the frustrations, their fears, their concerns, and all that's going to really help paint a better picture of what you're about ready to undergo. From a financial standpoint, we need to understand that too. Osseointegration is a brand new procedure. The question that I get asked a lot, well, is this going to be covered by my insurance? Again, that is a question that you really need to do some research and have some pretty specific answers for your own particular financial situation with your own insurance coverage, how the hospital is going to handle the billing, how your process is going to handle the billing. There's lots of different aspects. So you need to have eyes wide open. What is my financial burden going to be with this procedure? Sometimes that is listed as a relatively new procedure. So your insurance company, they say, oh yeah, it's covered as long as it's deemed medical necessary. You need to dig a little deeper. And if it's deemed medical and necessary, that doesn't necessarily say that your particular insurance or your carrier is going to cover the pieces and parts that are involved in that. It just says though, yeah, they agree that it's medical necessary and they cover procedures that are, but again, dig a little bit deeper to find out what is my financial commitment through the steps of this, both with the surgeon, with physical therapy, as well as with the prosthetist. Really need to make sure you have a good understanding so it's not a surprise at the end of that. So where does it begin? Do or not do. I love this quote that I found online because yeah, this isn't something necessarily you can try and go back away from. Once you commit to it, you're committed to it. And that's why I really need to know that this is going to be the right procedure for you. As I say, Facebook is not the holy grail of truth and wisdom. There's lots of information and the different sites that you can find generally monitor themselves very well. But when you get in a one-on-one conversation with someone, just again, vet this very thoroughly and make sure that you do your research and understand what you're being told is completely applicable to you and is also going to be very accurate. You are unique, and it's great for what others might have, but it might necessarily be the best for you. So understand, what your challenges that you may face, and learn from the others. But again, vet that. People are really passionate about osseointegration. Their numbers have been increasing quite a bit, and I think that's because it is an extremely successful procedure for the right person. But make sure you're a critical thinker. This is a huge decision, and it's certainly not to be taken lightly in any way whatsoever. So where do we begin the OI journey? Again, like I said, I think it's really important to find the team. The team here in Charlotte that I'm part of is comprised of a surgeon, the physiatrist or doctor of rehab medicine, physical therapist, the prosthetist, nutritionist, psychology, as well as a program coordinator. When my wife and I went through the process, we had just started the osseointegration team here in Charlotte. And the surgeon, with all due respect, said, I think me doing surgery on your wife probably isn't the best idea because we're too closely connected. And I appreciated that feedback quite a bit. What we chose was to go to UCSF, with one of the earlier programs outside of the military. And we had a phenomenal experience there. Dr. O'Donnell was very kind, and he was very deliberate when we went and met with the team, that we were not only interviewing the team, but the team was interviewing us. And that really kind of set me back for a minute, but it gave me so much respect because, it said to me that this wasn't a procedure that he was going to do because it was the latest, greatest procedure and wanted to build numbers for his own facility. He truly wanted to make sure any patients that were going to be included in the program were 100% appropriate and vetted and committed to this process and procedure. Again, this isn't something that should be taken lightly. And as much as we look at the skills of the surgeons and the various team members, it also takes a commitment on the patient's part that they're going to follow the steps and do the appropriate thing to make sure that they can have a successful outcome and not have something that's going to take a shortcut and could have devastating results if we don't look at that. Speaking just for a second, obviously the surgeon is generally going to be some version of an orthopedic surgeon. In Dr. O'Donnell's case, he specializes in osteosarcoma or cancer patients. A general trauma surgeon sometimes could do this as well. And many times you're going to have a plastic surgeon that's going to accompany your orthopedist along with this procedure. And so it's very important that you can meet the surgical team, understand where they're going to practice, if your insurance is going to cover the care within that particular hospital, whether it's in-state or out-of-state. Physiatrist, I think, is a great coach, and he or she can coordinate your rehab care, because many times there is going to be an inpatient stay in a rehab hospital, and I think that's important to have, as well as your physiatrist is a great resource to help you with some of those reimbursement challenges, because they can provide a lot of the documentation and the specific wording and justification that your insurance company may look for to make sure they can justify this procedure. Physical therapists is super critical. They're the ones that are going to really work you through the process of your pre-rehabilitation, making sure that you're strong enough, you're in good shape prior to the surgery, and then certainly afterwards, working you through the different weight bearing as well as the initial gait training and more advanced gait training as we get you going. You're going to need to have a physical therapist that you have access to, because it is going to require quite a few visits with that physical therapist, as well as check-ins with them. You don't necessarily have to have a therapist that is fully trained, but certainly your prosthetist and your surgeon, your physiatrist need to put them in contact with a physical therapist that does have some good experience with osseointegration and can work with your physical therapist in your area so that they can be properly trained and have the knowledge and expertise to be able to work you through the process. Your prosthetist, we are still involved, even though we're taking away the socket. There's still a lot of critical components that we need to know about in terms of your prosthetic alignment, your prosthetic gait. The fitting of your postoperative prosthesis is going to be very important, and as well as the maintenance and the fitting of your componentry down the line. So you still need to have a good, excellent relationship with a prosthetist. Some centers have a specific prosthetist that will work within the team and can work closely with your prosthetist. If you're outside of that area, or you haven't worked with that particular prosthetist, the prosthetists can work with each other very closely. It is good to have the prosthetist that has a very strong relationship with the surgeon, so that they can communicate back and forth with each other if there's potential problems, and have the perspective of working with osseointegration patients to know what some of those unique challenges are, because they are somewhat unique challenges that osseointegration patients will face. Nutritionists is really important. Many surgeons, and I think the vast majority, if your body mass index is over a certain point, they won't do surgery on you. You have to be at a reasonable weight, but you also have to be very healthy. If you haven't worked with a nutritionist before and you're kind of turned off by it, I would say it's one of that input that you can really get that can help the healing process considerably, because a healthy diet as well as a healthy weight is extremely important. Your body has to be at the best to be able to recover and go through the process. Psychology, why the heck do I need to talk to a psychology? Well, for one, you're going to have a piece of metal sticking out of your leg, and that's certainly different than what most folks are used to. And just the loss of a Okay. Where the journey begins. Roughly, there's 17 centers in the U.S. That are currently doing osseointegration, and several more are coming on board very quickly. It's quickly becoming the standard of care, but it's still in the early stages. Advancement, modifications, and protocol are also occurring. So, and I say this in terms of if you hear what one patient goes through, just and what your surgeon, your team is telling you is a little bit different. Follow the recommendations of your team. Certainly you can question it, but just know that we've learned a lot along the way. And even here in Charlotte in the last year, our program and protocol has changed and advanced as we've gone. Requirements for surgery. Each program is going to have those requirements. Some of the ones I've listed here are weight control, medication restrictions, history of infection, bone density, your prosthetic history, access to follow-up care, psychological health, as well as your team support. Weight control, like we said, you have to be within a certain body mass index. Medication, a lot of surgeons will require that you have no opioid use prior to the surgery. Reason for that is one, they want to make sure that's something that they're going to be able to control as you recover from the surgery, but also the overall health. Prolonged opioid use can be extremely detrimental, and obviously something that all of healthcare is watching very closely at this time. If there's any history of infections, we want to make sure that your body is currently clear of infections, and that we also know how to manage that appropriately. Bone density is something, again, to make sure that that bone is solid enough that it can take the instrumentation that the doctors are going to be giving you. And also we're going to look at prosthetic history. How successful have you been with a prosthesis? Have you tried everything you need to try? What are some of the challenges that we face? Access to follow-up care, getting in so that you can visit with the surgeon on a routine basis, as well as the physical therapist like we talked about. Psychological health, making sure that you're good between the ears and you're ready for the challenge that you're going to have. Also the team support, your loved ones helping you through the process, because there's going to be a time when you're not going to be ambulatory. We need to make sure that you have the appropriate help and support to be able to do that. So again, we really got to address the body, mind, and the spirit. Make sure that you're the best you that you can be prior to this surgery. So if there's some struggles, some things you're going through, again, the surgery isn't going to take all of those away. And we need to make sure that we're in a good mental state to be able to get this taken care of. So here we go. For the purpose of today's talk, I'm really going to focus on the OPRA system. And the reason is because that's the one that I'm most familiar with. That's the one we use here in Charlotte. And that's the procedure that my wife went through and we've done the most research on. That's not to say that the other processes aren't good. It's just the one that we chose because we thought it was best for us. The OPRA system is a two-stage procedure, meaning there's two different surgeries before you're up and going and fully weight bearing. It has received PMA, which is the highest level approval from the FDA. The other procedure is what's called humanitarian exemption. Again, talk to your surgeon and your OI team in terms of what implications that'll have in terms of coverage and that type of thing. But again, just kind of speaking from my knowledge of the OPRA system. And certainly, like I said, there's other systems out there, just do research on those. So for the OPRA system, we have the stage one. The stage one involves an insertion of what's called a fixture. This is into the medullary cavity of the bone. In our case, we're talking about a femur. Medullary cavity is basically that hollow space on the inside of our bones, our long bones. It's a metal rod that is actually threaded on the inside, and it has some special etching on the outside of that fixture that's going to allow the bone to securely attach. And that's where we speak to the osseointegration. So basically the bone grows around that and makes it very secure within the middle of that bone. Here are some x-rays that I have of that. The x-ray you see on the left is actually a very short residual limb that we were able to do here in Charlotte. The picture on the right is a picture of my wife when she had her stage one surgery. And you can see in the bottom of that x-ray, there's a little bit of a cap. So while there is a threaded center of that rod, it will be, there's a plug that they put over top of that. So the end of the bone will still be smooth in appearance. And you can see what the surgeon's going to do is close up the residual limb. It's going to look very similar to what your limb looked like when you first had an amputation. And this can be done fairly quickly.
Michael, do you mind sharing your screen again? We can't see it.
Oh, no. Okay. The menu's not popping up to let me do that. Let's see here.
On the green button at the bottom says share
Yep.
screen.
Yeah, that bar's not coming up right now. Let me just escape out of here real quick so we can get.
Hi, everyone. We're just having a couple of technical difficulties. Just bear with us, please.
All righty. You still there?
Yeah,
Yes.
we're here.
Let's try that. Get back to this. Okay. Can you guys see my screen?
No, not yet. When you click share screen,
Mhm.
click the green square share screen,
Sure.
and then it's going to open up. Just click the tab you would like open. The PowerPoint. Perfect.
Awesome. Okay. There.